Today marks the start of Lung Cancer Awareness Month, and for more on some of the warning signs and how you can protect yourself, I'm now joined on the phone by Dr. Tammy Baxter, a thoracic surgeon at TriStar Health. Dr. Baxter, good morning. We appreciate you taking the time to talk with us. I want to start by asking you, who is more at risk for getting lung cancer, and what are some of the warning signs that they should be looking out for?
Good morning. So we know that most people who end up with lung cancer are either current or former smokers. So obviously that is the largest risk factor that we're aware of. However, we are aware that 1 out of every 5 women who are diagnosed with lung cancer are actually never smokers. So there clearly are other risk factors that we have to be aware of. Some of those include both secondhand smoke, if you lived in, particularly if you lived or worked in a place that had allowed smoking. And then we know a problem here in Middle Tennessee is exposure to radon, which is a naturally occurring gas that can be prevalent in some of our basements or areas of our homes. Unfortunately, when it comes to lung cancer, if you're having symptoms, this too often means that your cancer is more advanced. So we're trying to promote, and we have a really good screening test now for lung cancer that allows us to catch the cancer very early before any symptoms are actually present.
Can you tell us a little bit more about what these symptoms are that people should be looking out for, Dr. Baxter?
So the most common symptom of lung cancer is going to be shortness of breath or cough. But again, unfortunately, those usually indicate a much further advanced. Most of us have more lung function than we actually need. So you can actually grow quite a large cancer before it's creating any symptoms. So we're putting our focus on screening patients that we know to be at risk so we can catch these cancers before they start making symptoms.
Wow. And Dr. Baxter, how has the pandemic impacted the number of people coming in for screening? Have you all seen any changes in that over the last couple of years?
Unfortunately, I think we all are very well aware that with the last couple of years that many of us have not left our homes for all the normal things that we are doing, and we're seeing that we're behind in screenings across a multitude of cancers, and lung cancer certainly is one of those. So we're encouraging, as the numbers are getting better and we have vaccinations available, that everyone start to catch up on any of their screening tests or their regular doctor's visits that they might have missed. And if you're at risk for lung cancer, I certainly would encourage you to discuss with your primary care doctor about getting a lung cancer screen.
And Dr. Baxter, I also wanted to ask you, you talked about the more reliable screening options. Over the years recently, has that led to more people being diagnosed sooner? How much of a difference has that made recently?
Absolutely. Until within the last 5 to 7 years, we didn't have a reliable approved screening method, and now we are offering a low-dose CT scan of the chest, and that has actually allowed us to increase the number of early-stage lung cancers that we're able to diagnose and treat, and we're actually able to start changing the numbers of patients surviving lung cancer. For a long time, the survival rate for lung cancer was very dismally low, and by and far that was because we detected lung cancer at such an advanced stage. This is allowing us to detect lung cancer early, which is when it is curable and the easiest to treat. So we're affecting change on long-term survival for patients with lung cancer.
Wow, that is remarkable. Dr. Baxter, thank you so much for your time this morning sharing this vital information. We appreciate it.
Thank you.
And folks, keep in mind, for more information on Lung Cancer Awareness Month, just head to WKRN.com. We'll have this whole segment posted under the Watch tab.